right, it's time to start. Good afternoon, everyone. My name is Francesca Zanni. I am a medical resident in public health at the University of Bologna and a junior advisor at the Technical Advisory Group Preparedness 2.0 at the World Health Organization Regional Office for Europe. It is my great honor to welcome you to the Italian launch of the Lancet Countdown report on health and climate change in Europe today, an event which is hosted by the Italian Association of Epidemiology. And that couldn't really be more timely, given that Italy and Southern Europe in general have been identified now multiple times as hotspots of the effects of the climate crisis on health and society at large. So before I give the floor to Dr. Carla Ancona, who is the president of the Italian Association of Epidemiology and will greet our speakers today, I would just like to give some preliminary housekeeping remarks. As you may know, the webinar is going to last for 2 hours today. It is registered, so you probably have been asked by Zoom to give your consent to being registered today. We will first have some institutional greetings from the Italian Ministry of Health and the National Italian Institute of Health. Then we have with us an author from the Lancet Countdown, which will provide an overview of the Europe report of the Lancet Countdown. And then we will zoom in on Italy with a specific analysis of 6 of the 42 indicators addressed in the Lancet report, which are particularly relevant for the Italian context. The question and answer time is at the end of the webinar. So if you have any questions for any of the speakers, please write them in the question and answers tab on Zoom, and we will do our best to address them all at the end. So without further ado, I leave the floor to Dr. Carla Ancona, and wish you a pleasant webinar.
Thank you. Good afternoon. And once again, welcome to the webinar of our association. We are really greatly honored to have organized this Italian launch of the new Lancet Countdown report. And I really want sincerely to thank Francesca Zanni for this opportunity. Thank you so much, Francesca. Thank to all the speakers and to all of you who are joining us today. I shall not take any more of your time, so I will promptly hand over to Dr. Rossi from the Ministry of Health and Marco Martuzzi from the National Institute of Health for a brief but welcome institutional greeting. So please, Lino, floor is yours.
Thank you, Carla. Thank you, Francesca. Thank you for this opportunity. It's important. Italy is part of the Lancet Countdown, especially because so far from keeping a speech, a formal speech of welcome, as usually do during many meetings, which is quite mainly institutional. Today, I would like also to stress some points regarding the Italian activities that would be important also for the activity of this group. As you know, Italy is carrying out a series of projects, plans, and actions addressing climate change and health response. First of all, in December 2003, we have approved and adopted our National Climate Change Adaptation Plan, so-called Piano Nazionale di Adattamento ai Cambiamenti Climatici, which provides a stronger policy framework of action and provides guidance on developing regional and local climate change adaptation plans, which include the health sector, of course. We are in the Ministry of Health here. Prior to this, in terms of climate change and health response, the Italian 5-year National Prevention Plan 2020-25 formally included the environment, climate and health as one of the core macro objectives supporting the promotion, development, implementation of preparedness and response to climate change. Most recently, as you may know, through the Italian National Recovery Funding, Piano Nazionale Complementare, which is something nationally financed, but in complement to complement the recovery fund coming from Europe. The Ministry of Health has funded projects addressing health, environment, biodiversity, and climate, which will specifically address and support the implementation of climate and health adaptation and mitigation measures at national and local level in line with national policy and focused on health co-benefits, as well as providing scientific evidence, promoting knowledge and capacity building among stakeholders and policymakers to enhance multi-sectoral response and actions to climate change. We have 14 projects plus 2 in contaminated sites for something like 70 million euros directly financed by the Ministry of Health, plus all the financing coming from the Ministry of Health, but mediated by the National Italian Institute of Health to regions for infrastructural interventions. And so we are, I want to conclude because for the sake of time, but I have to say something. The health sector, through leadership and intersectoral governance, according to an evidence-based model, operational programs, surveillance and monitoring, will and shall promote progress in addressing environmental, social and climate risks in order to obtain joint benefits in the short, medium and long term. Overcoming the logic of the silo on which we have moved so far, the health sector will assume a role of leadership and transversal coordination, collaborating with the sectors relating to health, the environment and climate change, therefore, I would say everyone, for the improvement of our sons' lives. Thank you.
Thank you. Thank you very much, Lino. And now I leave the floor to Marco Martuzzi from the ESS in Rome. Please, Marco.
Thank you, Carla. Thank you very much to you and, of course, to all the organizers of this webinar, which I am delighted to give my welcoming message to. In the Nationalist of Health, we are fully committed to this agenda. I am the director of the Department of Environment and Health. We are including now the word climate in most of our work, environment, climate and health, because of course the topic is central. We work together with the Ministry of Health, which you just heard from Dr. Rossi, the wide range of activities that are underway, and we are fully committed to implementing that program, which includes a lot of projects and investments to help respond to the health impacts, current and projected from the climate crisis. It was said in the opening, this webinar is timely, and it is very timely indeed. You will have seen probably the latest data from global monitoring, Copernicus, for example. A few days ago, the news came out that in the last 12, 13 months, we broke all records. The global temperature compared to pre-industrial levels has now increased 1.64 degrees. So the famous 1.5 limit of the Paris Agreement is already breached. And if you look at the Lancet Countdown report, the 2024 report, which will be discussed in detail shortly, you see some elements of improvement since 2022, but also a lot of negative signals of trends that continue to go in the direction of more pressure from the climate crisis, and not only the climate, biodiversity loss and a number of other things, and their impacts on health, including this very troublesome dimension of inequalities. So overall, I think it's very important that, I mean, it's difficult to not to be pessimistic. I mean, all these messages are rather troubling. We often discuss among ourselves and others, of course, issues like eco-anxiety. I mean, it's the dimension of mental health linked to climate change is also growing. A lot of interest and attention, because it's a very tangible impact which is already underway on everybody's health, I should say. So in this regard, I think it's really central that the health, I would include in the role of the health sector, which we've discussed for a long time, and very committed to pushing the agenda of co-benefits, pushing the agenda of decarbonizing health systems, which are still responsible for large proportion of emissions. It's also important that we struggle, we do our best to keep our mind clear on what can be done, because we are in the unique position, I think, of doing something about, trying to do something about it. I was very pleased to see, I preview some of the slides that will be shown later today, that the WHO website and others refer to climate change as one of the biggest threat to health of current time, something like that. And the world's biggest threat crossed out to say opportunity. So really, I think this community has to really do its best to raise this issue of opportunity, to explore and make the best of what can be done. And there's a lot of things that can indeed be done to counter this very, very important threat. So with that, I wish everybody a good webinar. Thanks very much again for organizing and having me in the opening, and look forward to the presentation. Thanks very much.
Thank you, Marco and Lino. Thank you. I've mentioned also the equity dimension and also the anxiety, which is very important, together with mental illness, especially for the younger sector of our population. So thank you so much for mentioning that. But I'll give the floor now to Michele Carugno from the IE Directorial Board, who will be our chairperson. Please, Michele.
Thank you, Carla. Thank you very much to the organizers. I'm very honored to chair this webinar with such an outstanding lineup of speakers. And so without further ado, I'm introducing the first speaker, Elisa Gallo, which is a postdoctoral fellow working mainly in the Horizon Europe project Catalyze, that stands for Climate Action to Advance Healthy Societies in Europe, at IS Global in Barcelona, Spain. And as it was already mentioned, Elisa is one of the authors of the 2024 Europe report of the Lancet Countdown on health and climate change, and she will introduce all of us into the findings of this report. Just as a reminder, Elisa, you will have 20 minutes, and we will have a timer to help you with time keeping. The floor is yours.
Yes, thank you. Thank you very much. I hope you can hear me well and you can see my screen. So I really thank you for inviting me to present the 2024 Europe report of the Lancet Countdown on health and climate change. And through these presentations, I will show you a bit about the Lancet Countdown. So what is the Lancet Countdown, why it was created, and what's the main aim of the Lancet Countdown? And then I will show you some of the indicators that have been created in this year's report of the Lancet Countdown. So basically, the Lancet Countdown is a collaboration that brings together over 300 scientists across the world, with the aim of producing scientific evidence on the evolving links between health and climate change. Different reports have been published by the University College of London, and they were highlighting the issue of climate change that was in a first moment defined as the biggest threat of the 21st century. But then this view was a bit changed, and now we can, from a different perspective, we can look at this as the biggest opportunity of the 21st century, because basically all the actions that we take here to protect our health, to adapt and to mitigate to climate change are actually good for our health in terms of working towards a cleaner air, more inhabitable and equitable cities, and also healthier diets. So over the last year, the Lancet Countdown has been publishing a series of reports on a yearly basis in order to track the impact of climate change on health and the actions taken by the government in terms of mitigation and adaptation. This started in 2015, and this year we will have the 10th report published in the Lancet. So the family of the Lancet Countdown has grown a lot in the last years, and we now have different regional centers. We have a center in Oceania, in Latin America, Asia, Europe, Africa, and small island and developing states. Regarding the Lancet Countdown in Europe, it started in 2021 under the leadership of Dr. Lecher Low and Dr. Tim van Dalen and from the Barcelona Supercomputing Center, and the co-direction of Dr. Catherine Ton from Barcelona Institute for Global Health. So this collaboration brings together 42 different institutions with the same aim, with the same purpose of studying climate change as an health issue. So over the last few years, different publications have been done by the Lancet Countdown in Europe. In particular, the first publication was an outline scope of work in September 2021. And then the first indicator report were published in October 2022 and included 33 indicators from 44 different researchers across Europe. And then finally, we have the report that has just been published in May this year with 42 indicators from 69 different researchers. As you can see, the collaboration is growing, and we are producing new evidence to help decision makers across Europe understand and prepare appropriate actions to deal with climate change as a health issue. And in particular here, we not only increased the number of indicators included in the report, but we also improved the pre-existing ones by adding different dimensions, for example, strengthening the methodology, enhancing the geographical coverage or the resolution. And in particular, this year, the focus of the report was on inequities and justice. So some of the indicators have been published in the European Climate and Health Observatory. So you can, through this tool, you can have a look at the data of some indicators, you can interrogate them, and you can also see the differences between different regions and countries. Well, the collaboration is very active, as you have already seen, and we also included stakeholders at the European Commission, at the European Environmental Agency, and at the WHO in Europe. And we have also collaborated with many different partners to produce policy reports, in particular with the Copernicus Climate Service for Health and several European environmental agencies. So now let's go a bit more in deep to look at this year report. So I wanted to start with this sentence that is taken from the manuscript. That is, the climate crisis is already happening. It's not a far in the future scenario. This will be a bit the leitmotif of all the report and will be the leitmotif of the presentation. And I will show you different indicators that will bring evidence to confirm this statement. And a second important point that I wanted to mention at the beginning is that we saw that Europe is making some progress to reduce the carbon intensity of its energy system, but the current trajectory results in net zero only by 2100. So really, we are going really too slow in this process. So the Lancet Countdown Europe is divided in two working groups. There is the first one that is on climate change impact exposure and vulnerabilities. The second one on adaptation planning and resilience for health. The third on mitigation actions and health co-benefits. The fourth is on economics and finance, also the impact that climate change can have on the economy of different countries. And finally, the politics and governance, where we are looking at the engagement of different governments and different, well, aspects of engagement of the general, also of the general public. So regarding the first section here, for sake of time, I can't present all the 42 indicators. I will just present some of them. But I really encourage you to go through the report. There are many indicators. They are really interesting, and they can give you really a wide view of what's going on in different aspects. So the section 1, it's climate change impacts, and we have indicators on heat and health, on the extreme events, and climate sensitive infectious diseases, allergens, and food and water security. The indicators that you see highlighted in green are the new ones, or have inside them a new part that was not published in the previous report. So the first indicator I will present you is the heat-related mortality. We have seen from a previous publication that in 2022, more than 60,000 deaths were attributable to heat in the summer in Europe. So what these indicators want to do is to track the increase in heat-related mortality between 2 decades. So the heat-related mortality in 2003-2012 and 2013-2022. And here what we observed in the overall population is that we have an increase of 70.2 deaths per 100 inhabitants when we compare these 2 decades. And another important result that you can see here in the 2 maps is that the heat-related mortality was almost twice as high in women, that is the right map, compared to men. Now moving on to the droughts. First of all, here you can see a map of Europe with the different regions that have been analyzed. You see the Northern Europe, Center, Eastern, and Western. Italy is white because we didn't have enough data to include Italy in the indicators, and I just use this example to explain you that this issue of the data is quite important for us, because many times we have many ideas for new indicators, but the problem is that we don't have the data, especially this time that in this year that we wanted to see the effect on equity and justice. It was really hard to find data on these topics. But now moving on to the results, in brackets, you can see the percentage of regions with increased droughts. In particular, we can see that in the Western Europe, we have an increase in moderate, severe, and extreme summer droughts when we compare 2 decades, 2000, 2009, and 2010, 2019. In Southern and Eastern Europe, we also see a worsening of droughts, especially extreme droughts, while in the Nordic regions, we see a decrease in drought. And especially in the southern regions experiencing drought, the 50% of this region also experience water scarcity. Now, a quick look at the climate-sensitive infectious diseases. These pictures put together 4 different indicators, so I will just go quickly through all of them. Basically, with climate change and rising temperatures, what we have is the better suitability for pathogens and vectors in our regions. So here we have an indicator for West Nile virus, where we can, in the top left, when we can see that there was an increase in the risk of outbreaks of West Nile virus, especially in Eastern and Southern Europe. For dengue, we see an increased suitability in all of the region of the European region, and also an increased estimate of import of dengue from regions in which it is endemic to Europe, where it finds good conditions, good suitability for transmission. And then on the map on the bottom left, you can see the region suitable for Leishmania in Europe, and in purple, you can see how in the last decade, so in 2011-2020, we have even more regions that are suitable for leishmaniasis. So basically what we observe is that the number of regions suitable is increasing each decade, and it's moving to the north of Europe and to the center of Europe. And for ticks, the last map on the right, we can see that the region in center and northern Europe are becoming even more suitable for ticks, and all the consequences like Lyme diseases or tick-borne encephalitis. Regarding adaptation, we are tracking different types of indicator here. I will just show you one, that is the city level climate change risk assessment. We have 185 responding European cities, and 81% of them confirm to have conducted a climate risk assessment, while some of them are in progress and others say that they will be undertaken in the next 2 years. And the most mentioned health issues were the heat-related illnesses, respiratory diseases, physical and death due to injuries, and death due to extreme events, mental health, and so on. And the population at risk was again the women, older people, outdoor workers, frontline workers, indigenous people, so the minorities basically. Regarding the mitigation and health co-benefits, here we see the mitigation in terms of greenhouse gases emissions, air pollution, sustainable and healthy transport, food, agriculture and health, and the health sector emission and arms. Here we'll present first the indicator that I mentioned at the beginning. So the one about the trajectories that gives us quite negative and pessimistic view of the situation. We see that in many countries there is a decrease in greenhouse gas emission, but it is really very small decrease and it's going too slow. And in particular, in 2021, the combustion from fossil fuels was 6 times higher in Europe than in Africa per capita emission and 2.7 higher than in Central and South America. Regarding the air pollution, here we see that in the period from 2005 to 2020, we have a decrease of mortality. In particular, here we analyze the PM 2.5 attributable death from fossil fuels. In Europe overall, but here there is another aspect to analyze. So it's good this from a public health perspective. We have increased level of PM 2.5, but this decrease is due to better control technologies that decrease the PM 2.5, but they do not decrease the greenhouse gas emissions. So here the take-home message is that we need more policies that can bring together climate change and health and not treat them as two different things. They are strictly correlated. Regarding the diet, we have seen that in 2020, this indicator shows that 2.48 million deaths were attributable to imbalanced or non-sustainable diets. This means basically to a problem in the diet composition with too much red meat, few fruit, vegetable, or nuts. This was quite similar. The number of deaths was quite similar in men and women. But if you look on the right, here you can see that if we compare 2010 and 2020, we don't see a big decrease in mortality and diet-related death. So things have not changed a lot between 2010 and 2020, and this is really a huge problem, especially in Eastern Europe. Now to regards economics and finance. So here we see the impact of climate change on economy and the economics of the transition to zero carbon emissions. In particular, I wanted to highlight these indicators that evaluate the change in labor supply. So with the climate change, with warming temperature, we can see that the working hours are decreasing due to extreme temperature, especially with the outdoor workers. So what we have observed here is that if we compare the period 1965 to 1994 with the 2016-2020, we see that there is a decrease of the 1.5% of the labor supply. That means basically 17 hours per worker per year. And this is especially true for the south of Europe, and Italy is not exempt from this. As you can see in the map on the right, it's quite red with respect to the previous periods. And just some exceptions in the colder regions of Europe, including South Tyrol in Italy, where we saw an increase of the number of working hours, probably because of the warming temperatures. And finally, the public and political engagement. Here, what we analyze is the engagement from different aspects. So from the scientific point of view, so publication and many other studies in the scientific groups, the individual engagement with health and climate change on social media, so here the general public, the political engagement with health and climate change, the corporate sector, and the media engagement. Here, I will present two of these indicators. The first one is the one on the individual engagement. Here, many tweets have been analyzed looking for keywords related to climate change and to health, both in English and non-English. And let's say that the results that we obtain is that only 0.4 or 0.5, depending on the language, of the tweets were talking about climate change and health as an intersection. So we have, I know, around for non-English was like 7.8% of tweets on climate change, but they are not we don't see an intersection between climate change and health. And on the right here in the plots, you can see the distribution across the different months. And finally, the last indicator I wanted to highlight is the engagement with the European Parliament. Here, in this case, we are showing the results. You can see here the results from 2022, where basically all the speeches by the legislators on the European Parliament have been analyzed, looking for looking for words related to climate change or health. And we see for each country a good number of speech talking about health, a good number of speech talking about climate change. But when we look at the intersections of these two, only 10 speeches, so the 0.1% of the speeches were talking about the intersections. And even less, 2 out of 10 mentioned the inequality terminology. And so basically, to conclude, at the beginning, I told you that climate change is happening now, and that the indicators of the reports show you the impact of climate change on different aspects of health, together with the economic impact all around Europe, especially in the southern countries such as Italy, where we observed increased heat-related illness, increased extreme events, food insecurity, drought, and infectious diseases, among others. So the report this year wanted to examine different dimensions of equity and justice in climate change as health issue. And what we observe here is that the negative climate-related health impacts and responsibility for climate change are not equal across Europe, and that they are very often reflecting socioeconomic inequities and marginalization. And many European countries remain major contributors of greenhouse gas emissions and still provide us fossil fuel subsidies, despite health harms and the consumption pattern are resulting in carbon emission and health damaging air pollution in other locations. So not only where these are produced, but also in the surrounding regions. So finally, what we see is that Europe plays an important role in terms of greenhouse gas emission reductions. It really has the opportunity to lead the way to more ambitious climate policy. A failure to take more ambitious action to reduce greenhouse gas emission is not only putting us at risk of further climate change, but is also missing an important opportunity to promote public health in short term by, for example, reducing air pollution, shifting to healthier diets, and promoting an active form of transportation. So what we saw across all these reports is that climate change exacerbates the already existing inequality, and despite this, there is still little engagement with aspects of equality, equity, or justice in climate and then research, policy, and media. So finally, I would just thank you all for your interest in the Lancet Countdown. I would like to thank all the co-authors, and in particular Kim Van Dalen and Rachel Lowe for their big efforts to put all of us together. You can have access to the full report, but I really encourage you to have a look at it from this QR code. And finally, I wanted to acknowledge the financial support from the Wellcome Trust and from the European Commission through the ID Alert and Catalyze projects. So thank you very much to everybody.
Thank you very much, Elisa. Thank you not only for staying in time, but most of all for the clarity of what you just showed us, and for the very comprehensive overview that you were able to give us in such a short span of time. So thank you very much. I think you provided very important insights that will help us feed the discussion that I remind everybody we will have at the very end of our webinar. I also remind, as it was said at the very beginning, that everybody can write their own questions, in the Q&A section of the Zoom platform. We already have one. We will try to collect them and use them for the final discussion. So we now move to the subsequent session. That is, so we go from the very broad overview that Elisa just gave us to the to a zoom, as Francesca said at the beginning, on Italy. So with the session called Climate Change and Health in Italy, Exposures, Impacts, Mitigation Actions, and Health Co-Benefits. And we will go into it with some speakers that will guide us through 6 indicators of the Lancet Countdown. And the very first one will be the 1.1, heat and health. And the first speaker is Francesca De Donato from the Department of Epidemiology of the Regional Health Service of the Lazio region. Francesca, the floor is yours.
Thank you, Michele. Hello, everyone. It's a pleasure to be here today, this afternoon with you. I'm just going to give you a very brief overview of the heat effects in Italy and what we're doing in terms of adaptation and climate change mitigation, and how the topic is important and how we're trying to also link the work that is being done in the Lancet Countdown to work we're doing currently in Italy in terms of response, as mentioned previously also by the colleagues from the Ministry of Health and the National Institute of Health. Next slide, please. Thank you. So just very quickly, just to give you an overview, it's a very timely moment for this this event. I'm very happy that it's being run currently while we're in the middle of a heat wave actually in Italy. 17 cities have a level 2 or level 3 warning, which means that there's a high risk of health effects due to the high temperatures that are comprised between 34 and 38 degrees today currently, without even considering humidity, where they go up to 40 degrees. So it is a timely issue, and it is an issue that happens most years in Italy, as we know. So we're quite used to the heat, but again, we're not acclimatized perfectly, and we can do a lot, both in terms of individual response and public health response. Just to give you an overview of what we currently know today in terms of the health effects of temperature in Italy at population level, as you can see on the right-hand side, a recent national project that has finished, that has comprised several different research institutes, and it was coordinated by the National Institute of Occupation and Injuries, INAIL, focused on the health effects of exposure to extreme temperatures, both for heat and cold. Here I'm just showing the effects, the mortality attributed to exposures to temperatures between the 75th and the 99th percentile of temperatures in Italy. And as you can see, it's not just total mortality, as we already know from multi-center, multi-country international studies that have included Italy, but also national studies. You can see here it has an effect on total mortality, cardiovascular disease, respiratory disease, which we know a lot about, but also mental health issue, neurological disease, metabolic, diabetes, and renal disease and renal failure. That's a consistent issue that we've seen in Italian cities and consistently with the literature from all over the world. And again, within Italy, the geographical distribution of the risks are very diverse, related to the population, to the climate, and to different other factors that we need to take into account when we're planning response and adaptation measures. As you can see, the fractional attributable deaths ranges between 1% and 3% between the north and the southeastern regions of Italy. Overall, it's around 1.8. So there is quite a lot of a distribution, and we have to consider that when we're planning the response measures and vulnerable groups we should be addressing. So it is a consistent issue we've seen. We've also seen the phenomenon change over time, and we need to account for these aspects. On the left-hand side, I just report here some results from a similar multi-city, multi-country, multi-institutional research project called BEEP, again funded by INAIL, and another project called Work Climate, which focuses on the occupational setting and the occupational risks associated to exposure to heat. So it's not only the elderly, as we first thought, it's also the adult population, the working population, as among other vulnerable groups. And what these two studies found out in a series of research analysis and projects was that even within the occupational setting, not all different sectors of are exposed in the same way, and not all workers are exposed in the same way. Those that are most at risk include construction, transport, and agriculture, which is a big sector of our industry in Italy that we need to take into consideration. It's also young workers who are less experienced and have less training. It's also occasional workers who don't have the same, let's say, conditions or response from their employees. There's also an additional risk when they're exposed to heat waves or extreme temperatures, and response measures and warning systems have been put in place by the Work Climate Project, which is still ongoing and integrates the work that has been done in terms of the heat adaptation plan. So it's really important to identify the different vulnerable groups, which has been one of the core elements of the Italian heat response in terms of public health and response to heat. The next slide, please. Thank you. So I just wanted to focus on two aspects related to what we're doing in terms of heat and climate change response in Italy, focusing mostly on heat. In terms of adaptation, Italy has had a heat adaptation plan in place for over nearly 20 years now. It's coordinated by the Ministry of Health and Civil Protection. It has a series of different components based on what the WHO defined in its heat guidelines a while ago. It combines and works in synergy with regions and local systems, municipalities and local health authorities, and that is really the strength of the Italian heat adaptation plan. And as I said, it focuses on vulnerable groups. And what we've been seeing in recent years has been a reduction in heat attributable deaths over time, which suggests that adaptation measures are really important, can work, and we can reduce the impact on heat. So there's a lot of work we can do around this in showing the best indicators and evaluating what measures are being put in place and improving what can be done in the following years, considering the continuous rise in temperatures, considering climate change. The next slide, please. Another aspect that I wanted to focus on, it was mentioned earlier by Pasqualino Rossi from the Ministry of Health, is the funding that has recently been issued by the Ministry of Health from the recovery funds, focusing on the health co-benefits, so in line with what is being done also by the Lancet Countdown, so really showing how adaptation measures and mitigation measures can be beneficial for health especially, and can be a win-win situation, as also been recommended by the WHO. So it can be an opportunity, and we really need to have to show and support how these measures or where we should be addressing adaptation and mitigation to climate change in Italian cities, especially how we can improve knowledge on the impacts of climate change. The project will also focus on defining those interventions that maximize the health co-benefits and reduce the risks of climate change exposures and environmental exposures, while benefiting more, healthy lifestyle among citizens and improving the quality of life and promoting equity. The gong has just gone and I have finished. So thanks very much.
Perfect. Thank you, Francesca. Thank you very much. Also for staying perfectly on time. Maybe our sounds are too much. Maybe we have to tune them down a little bit. We move to the subsequent speaker. That is Giuseppe Bortone from the Environmental Protection Agency of the Emilia-Romagna region, that speaking about drought and floods will help us, which shed some light on indicator 1.2, extreme events and health. Thank you, Giuseppe.
Thank you. Good evening, everybody. And I wish to start my presentation from the first title, the first paragraph of the Lancet Countdown report that says climate change is not a far in the future scenario. And this is already happening. And this is also true by a perspective, a local perspective, like the ones I want to show you in the next slides. Next slide, please. So this is the situation of the climate change impact as far as the water resources are concerned in my region, the Emilia-Romagna region. It's just an example of what is going on all over in the nation, in our Italian territory. You see on the left is compared the increase in temperature at the global scale compared to the increase of temperature in Emilia-Romagna. We are also a little bit higher than the average at the global scale. In average, we have measured an increase compared to the 1961-1990 as a reference period of 1.1 degrees centigrade in average as an increase. And the other indicator is the higher frequency of extreme events and the drought and water scarcity that we are experiencing. And these are some representation. You see on the right in the upper part of the slides, the total precipitation anomaly that we recorded during the 2022, lasting up to April 2023. The red is the deficit in rain compared to the reference period. And as you can see, the red is a clear warning color that put in evidence the situation. So a very unprecedented long period of drought. In a couple of days, the situation changed drastically, and you see the results. We were beaten by a very terrible flood in May 23 after this very long period of drought, 600 millimeters in 17 days. You have to think that the average rain in Emilia-Romagna is 900. 4 billion cubic meter fall down through the rain, by the rain, in a very large but small part of the territory, and 450 square kilometers were flooded. 23 river banks collapsed simultaneously together. Even for our civil protection was a very difficult challenge to being in operation in that territory. Thousands of landslides, and all the district, the sewer districts were put in difficulties due to the flood. 17 victims. I have to say we were able to reduce as much as possible the numbers of victims. So even one victim is too much, but this thanking to the early warning system, together with the civil protection, I guess has saved a lot of person. Economic, 8.5 billion of the euros. Next slide, please. So you can imagine the impact even by the health. It's easy to imagine. With this slide, I want just to highlight some points. The first is the picture in the left, in the downer part of the slide. You see the red color is not they are not chemical pollutants. This is the results of the anaerobic conditions. The sulfur bacteria were working there, producing this color, and this meaning that we have to be ready to manage very serious change in the biogeochemical cycle. And this is another problem that can give also rise to health problem. And also the drainage of water coming from the flood, the draining operation. You see the mouth of the Reno River that discharge the load, the hydraulic, but even the organic load to the Adriatic Sea. And this gave rise to problem about the security and the safety of the bathing activity that need to be started. So flooding is sure under the changing climate can increase pollution risk. This is true. 50% of the industries are located in potential flood areas. We have to work very much in the resilience of our sewage overflows across Europe, and we are working for improving this overflow coming from the sewage system. Next slide, please. But the impact on the health and health risk can derive also by in period in which we don't have raining on the activity of the overflow the sewer. And this is an example that we faced during July 2022. If you remember, it was the very prolonged drought that we have to face with. And we recorded 2-4 times E. coli concentration higher than the normal in a very long part of our coastal area. There were no malfunctions of wastewater treatment plant, no activity of the sewers overflow, but a climatic situation that has to be followed, and we need to make further research, because in extremely way, I can say, the population dynamics in this condition, very particular, can change and can give rise to a very high growth of the E. coli gas indicator of the fecal contamination. Next slide, please. This is the last one. So I want to say that water management is one of the major challenges in the changing climate. Health of people is already threatened. This is clear. Understanding of the growing health risk is for us that work on the environment is fundamental. The gong is gone. And I want to say that I also agree. There are many opportunities. We need the capacity to have a better design, a better capacity in planning, and the natural solution, let's say, because the gong is really, it's a really gong, and the natural solution, the nature-based solution are the ones that we have to follow in order to face with the reducing the impact of climate change on environment and health.
Thank you, Giuseppe. Thank you very much for your talk and for staying in the given time. We now move to a joint presentation on indicator 1.3, climate-sensitive infectious diseases. The presentation has been prepared by Marco Tamba from the Zooprophylactic Institute of the Lombardy and the Emilia-Romagna region, and Paolo Angelini from the Emilia-Romagna region, and will be presented by Marco Tamba. Marco, the floor is yours.
Good afternoon, and we want to thank the organizer for inviting us to share with you our point of view. Our talk will be about climate-sensitive infection disease, focusing on arthropod-borne viruses. West Nile virus, indicator 132, and dengue, Zika, and chikungunya viruses, indicator 1.3.3. We work in the same region of the previous presenter, a region with a long story of West Nile virus. We met the virus for the first time in 2008, a year after the first indigenous outbreak of chikungunya in Europe, who occurred in our region in 2007. Next slide, please. So, as operators in public health, we start to work on preparedness, and now we have in Italy a national plan of prevention, surveillance, and responses to arboviruses that aim within 6 years to create a surveillance and prevention system from vector-borne disease. Not only those transmitted by mosquitoes, but also those transmitted by scent flies, such as Toscana virus, or by ticks, such as tick-borne encephalitis. The plan starts with the fact that the epidemiology of vector-borne disease is complex and includes many aspects, many factors. First of all, the agent and the ability of the agent to cause disease, what we call morbidity rate. This factor is important because infection often are asymptomatic, and underreporting is common. In the report the number of cases is used, but we have to consider underreporting as a confounding. It's important also the genetic of the agent that affects the ability to infect the vectors. For example, for instance, in Emilia-Romagna in 2007, the Asian mosquito, tiger mosquito, met with the chikungunya strains coming from Asia. And not secondary is the ability of the agent to overcome the cold months and thus become endemic. It's important to consider a vector, and talking about mosquitoes, it is different if the vectors is belonging to Aedes or Culex genus. Each species has its own biology and ecological niche that must be known, especially if you want to control the population. Environmental factors are important drivers, but accidental events such as floods can affect the epidemiologic cycle in the year they occur. For example, last year we have a flood in Romagna, and we see the West Nile virus before the usual. The influence of environmental factors should be better understood, especially in the light of climate change, through the development of predictive models. It's important for the epidemiological cycles of the disease if exist animals in the cycle, and we need to know if they are a reservoir or incidental hosts, which domestic or wildlife species are involved, because each species has its own biology and ecology as the vectors. Finally, it should be considered that people also have individual characteristics such as immunodeficiency and behavior that can facilitate the occurrence of cases of vector-borne disease. Some disease occurs more frequently in rural environment, other in urban environment. And finally, traveling is another important factor affecting the epidemiology of disease. Next, please. And what about prevention? If the epidemiology of vector-borne disease is complex, it's also difficult to implement a surveillance system aimed at early detection of the agent. All the components of the epidemiological cycle must be monitored, and this implies that different skills and authorities must be involved. Especially monitoring vectors in wildlife, and wildlife is very difficult and requires highly specialized personnel. Not because I work there, but the pivot of all activities are laboratory capabilities. We need diagnostic protocols for vectors, animals, and patients, for instance, in case of summer fever, and the case reporting system based on laboratory results and not just on the notification by clinics. We need machine learning predictive models that integrate environmental data with the results of surveillance system of vectors, animals, and patients at local level. There must be continuous training of operators. Staff motivation should be always high. In case of disease, there must be specific intervention procedures for each disease. If action is planned to control vector population, this should not be harmful to the environment. Finally, information campaign for the citizens must also be planned, because individual behavior is also important for the prevention of vector-borne disease. This integrated One Health approach could be applied also to leishmaniasis and tick-borne encephalitis, such as Lyme disease and Crimean Congo hemorrhagic fever. And I would like to say a few words about this last disease. In my opinion, it is an emerging threat in the Mediterranean basin, and the next report should be considered. Thank you.
Thank you very much, Marco. We are covering a very broad range of topics, and I think your final mention to the One Health approach is helping us bring us towards this broadness. We are halfway through our second session, and I take the opportunity to remind all the participants not to be shy and to use the Q&A platform to ask their questions that will be used for discussion. All our speakers will be participating and be able to answer your questions. So we can move further on with Andrea Ranzi, again from the Environmental Protection Agency of the Emilia-Romagna region, but this time he will help us shed some light on indicator 3.2, namely air pollution and health. Andrea, the floor is yours.
Thank you, Michele. Thank you to the organizer for inviting me to this webinar. And I talk about shortly talk about air pollution and no problem in Italy, relevant issue which with various national and regional initiatives aimed at reducing concentration and consequently mitigation of earth effects. Next slide. In the next slide, I report. Okay. In the left part of the slide, the situation, a picture about emission factor for PM2.5 from 1990 to 2022, the last available data at national level. We can see that the most relevant pressure factor is related to non-industrial combustion, namely typically domestic heating. And this slide refers to direct emissions. So primary particulate matter, we well know the importance and the relevance in terms of mass, about 50% of secondary particles, secondary PM2.5. And so these there are some sectors such as traffic or agricultural activities that contribute to a lesser extent to the formation of primary particles, as you can see, but remain relevant to the emission of pollutants that are precursors of the formation of PM2.5, secondary PM2.5. So also this aspect has to be considered. Moving to concentration in Italy, there is in this slide in this data from the Italian Institute for Environmental Protection and Research. We can see a decreasing trend in concentration, both in daily concentration and in annual mean, but with the still persistent problem of exceeding the daily limits set for PM10. I remember that the Italian legislation that required that the limit of 50 micrograms per cubic meter not to be exceeded more than 35 times per year. And we have some problem, still remain some problem in the Po Valley, the area of Po Valley, that the most critical areas from the environmental point of view. And regarding the annual mean of PM2.5, in the slide, we can see that we have almost all the respect of a limit of Italian legislation, and we are above the limit of the WHO suggested by WHO. The last part of the slide again refer to 2022 reported the so-called population-weighted exposure, that is the concentration calculated for considering the distribution density of population in our territory, and again in the orange part that range from 15 to 25, but is over 15 micrograms per cubic meter of exposure, show how the situation of the Po Valley and other some parts of Italy. And in the next slide, I show a focus on the Po Valley. Po Valley has long been studied through various studies. In this slide, I reported the main environmental study currently being completed at the end of this year. That is the Prepare Life project. This project managed by Emilia-Romagna region involved all the 6 regions in the Po Basin, again together with some parts outside of Italy, and it aims at implementing the measures foreseen in the regional plans, coordinating these measures, and in the Po Valley, and with the agreement between the region to strengthen the sustainability and durability of results. A part of the project is dedicated also to the chemical composition of particulate, as you can see in the right part of the slide. That is an important aspect underlined by the Lancet report, and also by the action that are currently being approved at European level with the so-called super sites. In Italy, we have some experience on this, and some projects that characterize the chemical composition of particulate. The last slide, moving to the end of my presentation, I reported some data about the health impact assessment of air pollution in Italy. In the left part of the slide, you can see the latest calculation we made at the national level of the impact of PM 2.5 to natural mortality, considering the 2 thresholds of the old WHO guidelines and the new WHO guidelines. And if you can see in the part that lined in red, we can see that we are in the range of 11-12 percentage of attributable fraction to pollution of natural mortality, with peaks of 16 in the Po Valley and 30-14 in the main large urban areas. In this period, as Dr. Rossi said at the beginning of this webinar, there are several projects aimed to tackle the environmental health problems. One of these is related to this restoration of health impact assessment, and is the outdoor and air and health and integrated atlas to support decision and research, with the aims that you can see in the project of objectives, in particular to provide an operational tool to support decision on outdoor air and health, starting again from estimation of the health impacts of air pollution. This project is managed by Emilia-Romagna region, with a wide participation of more than 20 institutions from 8 different regions, and as other projects financed by the National Recovery and Resilience Plan, it will end at the end of 2026. Thank you.
Thank you, Andrea. Thank you very much for your clear presentation. Now we go to the next speaker, Lorenzo Mangone from Imperial College London, that will give us some hints regarding indicator 3.4.2 on sustainable diets. Lorenzo, welcome.
Hi.
The floor is yours.
Hello, thank you everyone for organizing and inviting me, and for all the speakers that gave amazing presentations so far. As it was said, I will be talking about sustainable diets. I will be focusing mostly on some new indicators that we are developing to assess dietary adherence, and we're trying to use here at Imperial to see if it's possible to design a diet that is both sustainable and healthy. Next slide, please. I would like to start with discussing why it's so important, in my opinion, to focus on food systems when we were talking about co-benefits. We do know that the food system are one of the main actors behind the climate crisis. It's responsible, the global food system is responsible for about 1/3 of the total emissions. It is also the responsible for the greatest use of land worldwide. About 38% of the land is used for something that is connected to the food system. And the emission of just the food system are enough to make any hope of achieving the Paris Agreement goals a pipe dream. So we need to act, and we need to act fast on this system. And the reason why it's such in a terrible state is that it has been designed with the wrong principles behind. It is a profit-oriented system that tries to maximize profits and maximize returns without paying attention to what is actually sustainable, to what can actually be nutritious, and to what could be healthy or help preserve biodiversity. At the same time, there is also another face to this medal. It is also one of the systems in which mitigation policies can achieve the greatest results, because it could act as a carbon sink. So it could offset some of the emissions that we will not be able to completely eradicate. And it can also be incredibly important for co-benefits, such as co-benefits on health, but also co-benefits on, for example, biodiversity. What you can see on the right, it's a figure from a study that will be published shortly in Environmental Health Perspectives, in which we use system dynamics to try to see which type of policy can achieve the greatest reduction in yearly emission by 2050 and 2100. Using the global calculator. It's a free available tool that I invite all of you to explore and play with. And you can see how diet and food seem to be some of the area in which policies can achieve the greatest reduction in yearly emission by 2050. So acting on this field can give results quickly and can give incredibly important results. Next slide. What I would like to, however, it's quite difficult to study exactly how adhering to a specific dietary pattern can impact health and environment. And the main reason is that usually the indicators that we use to assess dietary patterns are specific for each different diet. So it's quite difficult to make a comparison between them. And they are also discrete. They're not particularly flexible. They come with some inherent biases. So something that we are trying to do is to change the way in which we think about adherence to a diet. Something that we are trying to do is to reimagine dietary adherence by imagining food as a space, a multidimensional space in which each dimension is one of the food categories that we use to define and describe a diet. In this multidimensional space, a dietary pattern will be a specific point. So each person will be a point in this multidimensional space. And it is possible to calculate the distance between this point that describes the diet of a given person and the reference point that, for example, describes the Lancet diet or the Mediterranean diet. By calculating the distance between these 2 points, you can obtain a measure of adherence to a diet or of distance from a diet. You can see this approach being used on 5 different dietary patterns: the vegetarian diet, the vegan diet, pescatarian, Mediterranean, and the Lancet diet. And this is the distribution of the distances in Italy for each of these patterns. So the closer you are to the closer you are to the left side, the more you're adhering to a diet, and the closer you are to the right side, the farther away you are from the diet. It is interesting to see how, for example, for the Lancet diet in Italy, there is a first peak, a group of people that follows it, but not too closely. And for example, for the pescatarian and vegetarian diet, they're quite right skewed. Because there is an amount of meat eaters that skew the entire distribution in a specific direction. Next slide, please. Applying these indicators to, for example, survival analysis, this is a Cox model that has been done for overall mortality, can show how adhering to specific sustainable dietary patterns, such as the Eat Lancet and the Mediterranean diet, is associated, being distant from these dietary patterns is associated with an increase in the hazard ratio for overall mortality. While something interesting, at least on the Italian level, we've done this analysis on both an Italian level and a whole European level, and the results are quite different. Following a balanced vegetarian, vegan, or pescatarian diet does not seem to provide the same amount of benefits. On the other hand, however, the Eat Lancet and Mediterranean diet, as you can see in the table, are associated with are still sustainable. So being farther away from them corresponds to an increase in kilograms of CO2 equivalents for greenhouse gas emission and yearly use of square meters of land for land use, but in a fashion that it's way less pronounced than it is for vegetarian, vegan, and pescatarian diet that are 3 to 4 times as more effective in actually reducing the emissions. So being farther away from them means having a higher emission and a higher use of land. Just one more time, next slide. Something interesting, it's also to see there are similar results for cancer incidents that follow a pattern that is quite similar to this. Some takeaway messages are that meat seems to be still the strongest driver for both greenhouse gas emission and land use and adverse health outcomes. And as it is, having a diet that is not particularly biodiverse and having a diet that is rich in ultra-processed foods, those are other 2 parameters that seem to be driving the diet in a direction that is neither sustainable nor healthy. So making some simple adjustment can grant big results. And as we said in the first slide, it can also help reducing drastically the emissions, the dietary emissions, at least in the short term. Thank you so much.
Thank you very much, Lorenzo, for this very interesting talk. And now we move to the very last speaker of this session, and we jump to indicator 5, that is public and political engagement, with Anna Gerometta. Anna is president of Cittadini per l'Aria, Citizen for Air. Anna, the floor is yours.
Yes, thank you very much for the invitation. I would like to take this opportunity to actually indicate that I will try to, let's say, highlight some of the critical topics in policy making and public engagement. And I would like to also highlight that we really need to strive to picture the situation of climate change from fear to hope in order to make sure that the political side in our country and the population is not frightened, but rather incited to change its attitude and behavior. Next slide, please. I would like to actually start showing one of the same slides that Elisa Gallo showed earlier, which is indicator 531, which actually does indicate the amount of times that Italian members of parliament have mentioned the topic of health and the number they have mentioned the topic of climate change. And although there is an enormous amount of times they have addressed the topic of health, it really shows that the two things are not really connected among each other, which means that really there is an underestimation by the policymakers between the impact of climate change and the topic of public health, which we really see, I would say, daily in policymaker and in the situations in which measures are designed and planned, the fact that we are not managing to have policymakers really connect also their planning to the impact of the climate change events. We are recently, Italy has submitted a week ago the Energy and Climate Integrated Plan, which is still weak. It has even a reduced perspective of renewables as opposed to what it was meant to be at 2030 with 63% instead of 65. We're still seeing investments in fossils and subsidies, so that really should be changed. We are facing a coming new legislation for air quality that shamefully sees the Po Valley to be a candidate for a 10 years postponement, which was strongly asked by Italy in the abidance to the limits. So we really need to push for better planning. In Europe, we also have the strategic agenda that this year is quite soft in environment. Can we switch to the next slide, please? And finally, what do we need to do? I think that during the air pollution negotiations, air quality directive, we've seen a health community, a scientific community that was super strong in advocacy. So I think that one of the first things that we should do in Italy is make sure that we have the scientific and health community at every policy making table. That is very important. We also need to make sure that this health and scientific community is really fully independent, because there is no way that we can really improve our policies if the health community that is sitting at the tables of policymakers is not really fully independent. We need to continue collaboration between civil society, health, and community, and support the inclusion of youth in our policy making, because they are the ones that are more sensitive to this. We have an unsustainable burden on our planet, and for this reason, also in communication, we need to drive towards a post-growth economical vision to ensure that really sustainable policies can be adopted and enacted. I would like to also highlight that on the website of VEB, you have the opportunity, which is the European Environment Bureau, you have the opportunity to sign and support the European Pact for the Future to prioritize green and just transition, which is a pact asking the European Commission to improve its European strategic agenda, which, as you know, will be decided in the next few days as a result of the adoption of the new Commission, appointment of the new Commission. You can see on the right-hand side the full potential of what we can do, and we can do really a lot. And to do this, we really need to have the scientific and health community engaged as much as possible to avoid that wrong policy making is let's say, adopted. I would also like to mention that there is a review of the environmental code going on, and it would be actually quite useful to have a link with the Commission that is working on this to make sure that the community of health and scientific community is really engaged. Thank you.
Thank you very much, Anna. Thank you very much for your contribution. I want to thank all our speakers for giving such great talks, and I think we fulfilled the objective. With the second session, we fulfilled the objective, the aim that we had, meaning to start from the overview that Elisa gave us at the very beginning and try to, from there, focus on the some hints from the Italian reality. So I think we managed to.
I think we lost our moderator.
Yeah.
So maybe while we wait for him to come back, I think on behalf of the Italian Association of Epidemiology and myself, oh, Michele is back. So
Sorry.
hi, Michele, we lost you.
Yeah, I noticed. I apologize for this inconvenience. I was just about to read the questions that came from our audience before leaving the floor to Lorenzo and Francesca for the conclusions. This first one is from Giovanni Biegi and is for Elisa, and that says he's a bit surprised that the data on drought in Italy were not found, and suggests a publication basically on asthma incidence influenced by climate change in Italy. So basically, I think this is just an opportunity to say that for further work from the Lancet Countdown working groups, there are data available in Italy that can be found. So maybe Elisa can just comment on this.
Yes. Yeah, sure. I saw it. I will for sure read the manuscript. I'm really interested in it. What I know about the drought indicator is the data that were missing were the data about the water scarcity. So I don't know if these data are available or not, or I don't know. I will read the publication and see it. And the problem was that the time series was not long enough because they were looking for a time series starting in 2000. So I will have a look, and for sure we can get in touch. And in case, I can also put you in touch with the authors of that indicator.
Thank you very much. Again, for you. One of the participants asked whether you could elaborate a bit more on the concept that at a certain point you just mentioned, that we should consider as conjunct factors both policies should consider as conjunct factors both climate change and air pollution.
Yes. So basically, in this indicator, we saw that air pollution is decreasing, that it's fantastic. But at the same time, we also saw that the greenhouse gas emissions were not going down, and in subsectors, they are increasing or they are just stagnating over time. So here, the point is that we know that greenhouse gas emissions are a key player in climate change. And so when we look at the policy, we should not only look at decreasing level of air pollution, but also decreasing level of greenhouse emission that can go together with the decrease in air pollution, because at this point we saw they were not decreasing together. So that's sort of is the link between the climate change, so the greenhouse gas emissions, and the air pollution and the policy. So put the two concepts together instead of looking at them separately. So this was the main key message.
Okay, clear. Maybe our speakers have questions for one another or other. How does Zoom call them? Panelists?
No, just a comment to Elisa. The National System of Environmental Protection in Italy produced a report on the climate change, and the data on drought are reported there. So please get in touch with the National Protection, the Environmental Protection Network, and the ISPRA, the research center. We produce a lot of report on climate change, and I guess even the cities are very significant in terms of elaboration of data about the water scarcity.
Okay, thank you. I will get in touch for sure. And then put in contact with the authors of that indicators, because I was not one of the authors of that indicator.
Okay, perfect. Thank you very much. I think if there's no one else, we can I can leave the floor to Francesca and Lorenzo for some final remarks.
Yeah, thank you so much, Michele. Thanks so much for all the speakers who took part in this event today, and for all the participants. Yeah, I think some final remarks on my side would be that there is really an urgency to act on the effects of the climate crisis on health and society. And a lot of reports have been coming out in the past months, and they all have highlighted how Southern Europe is really a hotspot in the region for the effects of the climate crisis. One of the latest of these reports from the European Environment Agency, which was also the first climate risk assessment in the region, analyzed 36 indicators, and 6 of them, including crop production, heat stress, coastal and marine ecosystems, they were all areas that were particularly and critically affected in Southern Europe. So we've also seen with COVID that sometimes international solidarity in times of crisis can be difficult to set up and manage. So we really need to gear up for what's coming. And I think in this sense, some let's say some hope comes from European citizens in general. There's been, I think in May, the latest Eurobarometer survey published on attitudes towards the environment in Europe. And according to this survey, 84% of citizens in the EU agrees that we need European laws to protect the environment, and 92% think the polluting companies should pay for cleaning up the air. And again, around 80% are worried about the effects of climate change on their health. So any policy on these topics, regardless of sometimes political propaganda or discussions, are really have broad support in the region. So I think this gives hope also to the professionals who are working so tirelessly in this field. Some of them we have listened to today. So thank you so much, and I will leave the floor now to Lorenzo Ricciardi, the Vice President of the the Italian Association of Epidemiology, for some final remarks.
Yeah, thank you very much. I've seen there is also a late question that I think we can answer to that. It's again for Elisa. It's not surprising because you presented all the results of the Lancet Countdown. So most of the question will be for you. And the question is that the person is asking that is reporting that the Lancet seems to focus, Lancet Countdown report seems to focus more on mitigation co-benefits than on the adaptation ones. So it's more focused on mitigation rather than adaptation. Could you just give your opinion on that in a few words?
Well, yes, we have seen a lot of indicators on mitigation, a bit less on adaptation. The point is here, it's a bit again regarding the data that are available. So we have many ideas of indicators for all these sections, all the working groups. But of course, then the problem is always find the data that are publicly available that represent many regions. And sometimes this is not so easy for all the countries here. I'm talking about the whole Europe. So we are trying to produce as many indicators as possible for each categories. And that's what we could reach now. In the next report, we hope to increase also the indicators in adaptation. If any of you have any idea about adaptation indicators that can be added, you can contact me or Kim Van Dalen or Richard Lowe or Catherine Tone to propose new indicators, because we are always looking for new people that are interested in joining the community. So yeah, that's basically my suggestion. So if you have any idea, let's join and let's talk about it. We are really open to explore any possibility that we can have to, well, improve all the section and in particular the adaptation one.
Okay, Thank you. This is, I'm sure you will. We will contact you. I mean, you will get some suggestions of people willing to actually contribute and help. I think that with that, I have the task of closing this actually amazing webinar. It's been really, really interesting. And I would like to thank the people who made this possible on behalf of the AIE, and starting with Francesca Zanni, who actually started the process and which brought us to the webinar of today. It has been great that you approached us and suggested to organize this webinar in conjunction with the launch of the Lancet Countdown. And I would also like to thank all the speakers and everybody who attended the webinar. I think we heard really important messages in this webinar, and we really can conclude that huge work is being done by the research community and the broader community of everybody who is interested to understand the effects of climate change on health, and also how to let's say respond to this challenge. Huge challenge has been also defined as an opportunity to change our way of living and our lifestyles and our environments. It's probably both. It's actually for sure both also a huge threat and also a challenge. It is, and also an opportunity. It is also clear that the biggest gap at the moment is how to translate all these findings into policies, into real changes. And this is always the case in many topics, in many aspects of research, and definitely it is the case for this really huge challenge that is climate change. So we will have to work on that, and for sure the Lancet Countdown is working on that direction. Would be actually nice to understand maybe in the future to quantify the impact that this kind of reports have on policies. Might be a topic for a new webinar. I'm sure we will have, as other webinars on this topic, as several people involved in AI actually working on this field. And so we will have other opportunities. I think we can close for today. Thank you again to everybody for organizing this and attending this, and have a nice evening, everybody.